Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cardiac ablation for atrial flutter. Introduction. Atrial flutter, or AFL, is a common heart rhythm problem. If you have AFL, your heart's upper chambers beat too quickly. Cardiac ablation is a procedure that can correct heart rhythm problems. It works by scarring or destroying tissue in the heart that triggers an abnormal heart rhythm. This program explains cardiac ablation for atrial flutter. It explains what atrial flutter is, how cardiac ablation is done, and possible risks and complications. The heart. Understanding how the heart works helps you to understand atrial flutter. The heart is an important muscle in the body. The heart has two sides, the right side and the left side. Each side of the heart has two chambers, an atrium and a ventricle. After the body uses oxygen that is in the blood enters the heart through the right atrium. The right atrium contracts. Blood is pumped to the right ventricle. The right ventricle contracts. Blood is pumped to the lungs. In the lungs, the blood is loaded with the oxygen that we breathe. From the lungs, blood that is rich in oxygen goes to the left atrium. The left atrium contracts. Blood is pumped to the left ventricle. The left ventricle contracts. Blood is pumped to the whole body through the biggest artery, the aorta. The organs and tissues take oxygen from the blood. Finally, the blood goes back to the right atrium. The cycle begins again. Heart contractions are synchronized. This means that the atria contract together and then the ventricles contract together. A normal heart rate at rest is usually between 60 and 100 beats per minute. The heart beats faster in response to stress or exercise. It can also slow down when a person is at rest. The muscles of the heart contract and pump blood because a small electric current activates them. The current starts in a place inside the heart. It is called the sinus node. The current causes the atria to contract and pump blood to the ventricles. From the sinus node, the electric current travels through fibers to another area of the ventricles. It is called the atrioventricular node, or AV node. From the AV node, the electric current goes to the ventricles. This causes them to contract and pump blood. Atrial flutter. Heart rate is controlled by electrical signals sent across heart tissues. Atrial flutter is a condition where the upper chambers, or atria, of the heart beat too fast. This results in atrial muscle contractions that are out of sync. In some cases, AFL causes no symptoms. The condition is only discovered during a physical exam or with a heart monitoring test called an electrocardiogram, or EKG. Symptoms of AFL may include chest pain, pressure, tightness or discomfort, dizziness, lightheadedness and fainting, racing, pounding or fluttering heart, shortness of breath. AFL is caused by something that disrupts the normal electrical impulses that control the rhythm of the heart. The impulses control the heart's pumping action. Many things can cause problems with the heart's electrical system. AFL is often found in patients with other health conditions, including heart disease and diabetes. Complications of AFL vary in severity. Possible complications of AFL are heart attack, stroke, or other heart rhythm problems. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. Your healthcare provider may recommend that you do a vagal maneuver during an episode of fast heartbeat. Vagal maneuvers include bearing down as if you are having a bowel movement, coughing, putting an ice pack on your face, If vagal maneuvers do not stop the fast heartbeat, you may need an injection of antiarrhythmic medicine. This can restore a normal heart rate. Cardioversion therapy may also help restore your heart's normal rhythm. In this procedure, a shock is delivered to your heart through paddles or patches on your chest. The current restores a normal rhythm. Treatment for AFL may also include medications to slow down the heartbeat, medications to thin the blood and help prevent a stroke, a pacemaker, an implantable cardioverter defibrillator or ICD, a maze procedure. Your healthcare provider may recommend cardiac ablation if it is the best treatment option for your case or if alternative treatments do not work. Before the procedure. Before cardiac ablation, tell your healthcare provider about any medicines you take. He or she may ask you not to take them before the procedure. Do not stop taking your medicines unless your healthcare provider tells you to. If you have an implanted heart device such as a pacemaker or ICD, ask your healthcare provider if you need to take any special precautions. Your healthcare provider may ask you to not eat or drink anything for a number of hours before the procedure. Arrange for someone to drive you home after your procedure. You will not be able to drive right away. Cardiac ablation. Cardiac ablation is done under sedation. This means you will be relaxed and may even fall asleep. In total, the procedure takes about 3 to 8 hours. Your vital signs, heart rate, and breathing will be monitored during the entire procedure. After the sedative takes effect, your surgeon will numb a small area near a vein on your groin, neck, or forearm. A catheter is then inserted into the vein. Catheters are long, flexible tubes. A special dye is then injected through the catheter. The dye shows up on X-ray images and helps the surgeon find the part of the heart that needs ablation. The catheter has special electrodes at the tip. Once the surgeon finds the area of abnormal tissue that is causing your arrhythmia, he or she will aim the catheter tip at the area. Energy will travel through the catheter tip to create a scar or destroy the abnormal tissue. The energy used can come from cryoablation or extreme cold, lasers, radiofrequency or heat. If you experience any type of severe pain or shortness of breath, you should tell the surgeon performing the procedure right away. Some minor discomfort is normal. After the ablation has been performed, the surgeon will remove the catheter. Depending on the area where the catheter was inserted, you may need to stay in bed for a few hours to prevent bleeding. Rarely, cardiac ablation is done through open heart surgery. Risks and complications. Cardiac ablation is a safe procedure. Complications are rare. You need to know about them just in case they happen. By being informed, you can help your healthcare provider detect problems early. The risks and complications include those related to sedation and those related to any type of surgery. Risks of sedation include headache, nausea, sore throat, vomiting. Rare but serious risks of sedation include infections, strokes, cardiac arrhythmia, heart attacks, death. Your healthcare provider will discuss these risks with you and ask you if you are allergic to certain medicines. Blood clots in the legs can happen due to inactivity during and after the procedure. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if any of these symptoms happen. Getting out of bed shortly after the procedure may help decrease the risk of blood clots in the legs. Some of the risks of cardiac ablation are seen in any type of procedure. These include infection, bleeding, skin scars. Other risks and complications are related specifically to this surgery. These may include damaged blood vessels and nerves, damaged kidneys from the dye used during the procedure, damage to the heart attack or stroke, scarring and narrowing of the pulmonary veins. Cardiac ablation may cause an irregular heart rhythm to become worse. In this case, a pacemaker may be needed. After the procedure. You will be monitored carefully after the procedure. Tell your healthcare provider right away if you notice chest pain, swelling, pain, or bleeding at the puncture site. Aspirin is often prescribed for 2 to 4 weeks after the procedure. This reduces the risk of blood clots forming at the ablation sites. Do not drive or drink alcohol for at least 24 hours after you leave the hospital. Avoid strenuous activity for at least 3 days. Contact your healthcare provider if you experience a fast or irregular heartbeat, dizziness or shortness of breath, increased bruising, swelling, or drainage at the insertion site, numbness or tingling in your leg, or your foot feels cold or turns blue.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Atrial flutter, or AFL, is a common heart rhythm problem. If you have AFL, your heart's upper chambers beat too quickly. Symptoms of AFL may include chest pain, pressure, tightness, or discomfort, dizziness, lightheadedness, and fainting, racing, pounding, or fluttering heart, shortness of breath. In some cases, AFL causes no symptoms. The condition is only discovered during a physical exam or with a heart monitoring test called an electrocardiogram or EKG. Cardiac ablation is a procedure that can correct heart rhythm problems. It works by scarring or destroying tissue in the heart that triggers an abnormal heart rhythm. Your healthcare provider may recommend cardiac ablation if it is the best treatment option for your case or if alternative treatments do not work. Cardiac ablation is a safe procedure. Like all procedures, there are risks with cardiac ablation. Complications are rare, but you need to know about them just in case they happen. By being informed, you can help your healthcare provider detect problems early. Thank you for using Explain.